you now.
Thank you, Erika. I appreciate it.
Absolutely.
I put recording. It says recording, I see, but it doesn't say like, it doesn't say you got it, it's recording. It just it's open. Yeah, I think it's recording. Yeah.
Okay, well, I will have a copy, and I can definitely share it with you, Jacinta, but you can also do your own recordings, fine with me.
Thank you. Thank you.
Yeah, yeah. Yeah, I feel everything should be very open. I never put anything on in terms of limitations of chat. I just feel, we want to share, knowledge and information with all of us. So it'd be collaborative. I think that's what our world's all about. And definitely in the helping profession, we're very concerned about that.
Thank you.
Okay. Oh, I think it's almost fasten your seatbelt. I think it's about ready to to begin. So, okay. Well, let me just, I guess I should begin by introducing myself. I'm Elaine Congress. I'm vice chair of our committee on mental health and NGO at the United Nations. Unfortunately, our chair isn't able to be with us today. And for my day job, I'm associate dean and professor at Fordham University. And so I'm real pleased to be here. And we're planning a number of programs for this year. This will be a wonderful one that Dr. Kort has organized on media and mental health. And then we will be having something next month that I don't know if she's, if she's here yet, but we will also be having a program next month, on trauma, which will focus on kind of end of life decisions. So stay tuned. I'll tell you more about that. The next program will be on February 9th. And then we're going to continue with other programs. But you all will be on if this is the first time here, you all will be on our mailing list to find out about other programs that we are going to be doing. So without further ado, I'm going to turn the program over to a very able moderator and presenter who is a member of our executive committee, Dr. Felicitas Kort. And we can put her as a speaker so we all can see her. She received a degree in clinical psychology from Catholic University. Andres Bala is a Jesuit university, and I'm also at a Jesuit university in New York City, and hers was in Venezuela. She is professor, and she's a very experienced clinician on behavioral and cognitive psychotherapy. She did postgraduate training in psychiatry and clinical psychology at Central University in Venezuela. And Dr. Kort is a prolific author. She has a number of books in Spanish, and I don't know how many people here are bilingual, but I'll just tell you the titles of a couple of them. Chronicle of a Psychopath. And I wish my Spanish was better. That sounds very interesting to read, and very timely too these days, unfortunately. Manual of Emotions, Introduction to Behavior and Cognitive Therapy, Behavioral Therapy for Children, Behavioral Therapy Techniques, Clinical Behavior Therapy, Group Psychotherapy. And also for those of us who are only are competent to read in English, she has a book in English, The Human Potential Movement, A Behavioral Point of View. So without further ado, I'm going to turn over the program to Dr. Kort, who will kind of walk you through our program for today. Thanks for coming.
Thank you very much. I'm unmuted. Yes, it's a pleasure to be with all of you. Wow, it's first of all, dear colleagues and all of you in different parts of the world, because we really disseminated this information. It's our first meeting of the United Nations Media and Mental Health section. And Elaine, you've been so helpful and so receptive for us to start this year with this very, very, very difficult subject. And for the Venezuelan Association of Behavioral and Cognitive Therapies, it is a pleasure to initiate this year, 2023, with 3 Venezuelan clinical psychologists. The fact that the 3 of us are from Venezuela is a mere coincidence, believe me. We wrote to colleagues in the US and in Canada, but they were invited, but yet because of the beginning of the year, this was not possible in this occasion. I would like to share with you why I became interested in the NGO media and mental health. Because I was in Venezuela and I also invited them part of the Venezuelan Association of Psychotherapists. This is an association that covered all different schools of psychology, including behavioral and cognitive therapy. And it is affiliated to the World Council of Psychotherapy. And this is how we got to become part of the UN Media and Mental Health. But at one point when we wanted to celebrate in Venezuela, the Mental Health Day, and this is a real story, we were stopped because Hugo Chavez at that time, he had banned any public discussions about mental health. And what was the reason? Because members of the Venezuelan Psychiatric Association expressed opinions about his dysfunctional statements, about his emotions and behaviors. And they gave diagnosis, but this is not the point of this event today. So when I first came to the US, in one of my encounters networking, I met Elizabeth Carl. That was about 10 years ago. She was one of the founders of this NGO. As far as I know, I don't know the whole story, but she was at that time very active in the media mental health group. And immediately I accepted because I said, this is an opportunity for me to express really how I feel, my point of view as a behavioral and cognitive therapist, and believe me, I was able to do it perfectly. So I'm more than happy to. Can you imagine? Today is like the turning point of all these years. We want Venezuelans to be able to talk and not be subject to the gag law that we have still in Venezuela. Very much so. Always learn. I will start my presentation with a string of slides about research in major organizations in the US. And then I will mention a few how big groups work with suicide prevention. And finally, I will focus on the perspective of one of the eminent Canadian-American psychologists and influencer of the 20th century, Albert Bandura. And you will know where I'm going with this. Okay, so I will share screen. There it is. Share. This is my presentation. Wait, there. Can you see it now? Yes? Okay, there we go. Thank you. Let me minimize you. Okay. Is everything, can you hear me? Is it okay? Hello?
It looks good.
Okay, thank you. Okay, so we will start. Why doesn't it? I have to put share presentation. Wait, I have to put in the, the student can help me. I actually, well, I will continue. The American, but, okay.
We can see your presentation.
That's the important part, okay.
It looks good.
Definitely we're in a national emergency. The American Academy of Pediatrics and the American Academy of Child and Adolescent Psychiatrists considered in 2021. Hello? Yes? Okay. In the US, over 25% of youth die from suicide. And in 2019, suicide was the fourth leading cause in adolescents aged 15 and 19 years. In 2021, suicide, the second leading cause of death, young people 10 to 24 years of age. The basis, the main reasons were social. Can you hear me? I hear an echo. Social
If
pressure.
others can just please mute themselves, that would be great, so that
Felix.
Felicitas does not continue to get the distraction.
Thank you so much, Felix. I thought there was something. Okay. So the basis of the major what they considered the basis of national emergencies, the social pressures, the bullying, the isolation, and things that happen in home life, like domestic violence and domestic situations. I don't know why I'm not able to go to the next slide. Because I should, hello? Okay. Is someone helping me to put the next slide, or am I doing it?
You're controlling it.
Okay.
It's coming from your own screen.
Okay, thank you very much. So the rising rate of youth suicide, in a recent article from Solomon in the Mystifying Rise of Child Suicide in the New Yorker, he was specifying that between 1950 and 1988, the proportion of adolescents aged between 15 and 19 who killed themselves quadrupled. Then between 2007 and 2017, the number of children aged 10 to 14 was more than double. Available data are sparse and more fragmentary than for adult mental illness. So the Center for Disease and Control Prevention also in 2020 in the US claimed suicide the lives of more than 500 children ages 10 to 14 and 6,000 young adults ages 15 to 24. The Center for Disease and Control Prevention says that the second leading cause of death is suicide behind the accidental injury. So this makes it a cause of death as common as car crashes. And the National Institute of Mental Health in 2020 states that 3 million adolescents with major depression, 2/3 of them did not receive treatment. So the story is that too few child psychologists and psychiatrists, there are too few. Most pediatricians are insufficiently informed about depression and anger management. So what does the American Foundation of Suicide Prevention say? The chief medical officer recently, she, in this article of Solomon, Christine Humotier in the Journal of Affective Disorder declares, in children, the moment of acute suicidal urge is very short-lived. It's almost like the brain can't keep up with that rigid state of narrowed condition for long. Now we go to Venezuela, where a contrast in SECODAP in Venezuela, the Center for Defense and Human Rights for Children and Teens. This is, we don't have any statistics. We don't have mental health in Venezuela, so forget it. But this is Vanessa Moreno. She's a very savvy journalist in PANA Agency. And she presented in SECODAP in this center, which actually is associated with Save the Children, that 26 suicides of children and teens in 12 states of the country. Venezuela has all these states of, like in the US. And so 53% of boys between 13 and 13 years old and 46% of girls 14 years old. And 60% students in public schools, 61 suicides in the victims' homes, 11.5 in public spaces, and 38% in the schools of the victim. So for SECODAP, the causes of death by suicide are 50.7 due to family conflict, 3.8 due 8% to sexual abuse, 3.8 due to psychiatric disorders, and 3.8% unknown, for reasons unknown. So obviously we can see that very low income countries, zero health, well. So I found very interesting, I'm giving you this very recent information presented at the Department of Psychiatry in the Department of Psychiatry in the world round, in the grand rounds. This is Benny Almedani and from the Henry Ford Foundation. And he talked very profoundly about the Zero Suicide program, which is partnered with the Substance Abuse and Mental Health Services Administration. And they've gone to different states right now, like Michigan, Washington State, Colorado, Oregon, California. And their next step is Zero Suicide International. This is why it called my attention, because I said, well, maybe I did even send him an email about when is Latin America next in their program. And he said, next soon, relatively, he doesn't know exactly. So in this Henry Ford Health Foundation, they say that it's important to identify who is at risk in suicide. And I'm just mentioning just a few. This is like the tip of the iceberg. There are many, many other causes. But the main causes of mental health diagnosis is anxiety disorder or ADHD, you know, attention deficit, attention hyperactivity disorder, bipolar disorder, depression disorders, schizophrenia spectrum. So this is one people that are suicide at risk. And it caught my attention that he mentioned that this patient health questionnaire, which is very well known, PHQ-9, if the student or the person or whoever is getting this questionnaire, if they respond to the last question, thoughts that would be better, I would be better off dead, or think of hurting myself, this would be already a very red flag to think that this person may commit suicide. So I found it very interesting. You need to know ASAP what's going on, right? So the serious suicide kit, which they have, it's very extensive online. You can really find it, and there's a lot of information. They use research, tools, and videos. And the first thing is that they lead what they call the system-wide culture change to reduce suicides. So that's is very appealing to all the people who are not only in the US, but all over the world, that to be aware of the culture change. And I know Dr. Salas works a lot with this. Maybe he can present in the future about his work on culture and adaptation. Then train, it's important to train a competent, confident, and caring workforce. Then identify patients with suicide risk via screenings. And here, again, this is a tip of the iceberg. They have a whole array of screenings that can help identify ASAP when somebody wants to take their life. Engaging the individuals in a suicide care management program. Then treat the suicidal thoughts and behaviors using evidence-based treatments. Cognitive behavior therapy, dialectic behavior therapy, you've heard the two of them in this presentation, and pharmacotherapy. So there is a transition aspect which individuals need the care after the psychiatric hospitalization. They need to go through care and supportive context. Dr. Salas spoke a bit about this also. So, and then we need to improve policies through a continuous improvement plan. So that sounds a very interesting program at the Henry Ford Foundation. Now, this other group is working in a very interesting fashion. It's called the Coping Long-Term with Active Suicide Program. They target multiple risk factors for suicide and therapeutic strategies, like one, in-person and telephone. Then value goals clarification. And there, if we work on that, we can go directly to Viktor Frankl, who has, I'm sure you know who Viktor, or if you don't know, he's one of his icon books is The Meaning of Life, and he survived the concentration camp. He was in in the Holocaust, and then there is a very complete way to deal with values and goals, following Viktor Frankl's ideas, and very, very pertinent to what we're talking about now. Then problem solving is another aspect they use, therapeutic strategies, and significant other support, of course. These are all designed to reduce subsequent suicidal behavior in high-risk populations during times of acute risk and transition. And this information you can find, again, this is the tip of the iceberg, because Dr. Miller, Guadiano, and Weinstock have been working diligently in that and have several articles, and you can go online for sure and find it, or I can give you the information also. So what are the components of the Coping Long-Term with Active Suicide program? The three major components are like three individual in-person meetings, or one meeting with one significant other, a family meeting, and 11 brief 15 to 30 minutes phone contacts with the patient and his significant other. It's interesting that the editorial of the Lancet, who's, you know, it's a very prestigious psychiatric journal, their point of view is that the estimates in 2019 suicide as the fourth leading cause of death in adolescents aged 15 and 19 years. And additionally, a high number of children aged 6 and 12 years with social pressure, bullying, isolation, and home life, which sounds very similar to what we heard about Venezuela. So now I come to this. This survey really caught my eye in a very important way, because the New York Times partnered with Psychology Today, and the results were they did a survey, and it was overwhelmed by 1,250 persons responded. No, here you have 1,320 clinicians responded to this survey, and they were overwhelmed by the relentless demand on how to cope with anxiety, with depression, and suicidal thoughts. And basically there was a compassion fatigue and a burnout, which is very, very significant. So as demand for the services increase, mental health professionals have to turn away patients. And this is very impressive for sure. I'm sure you know where I'm going, and why I think that definitely we need a large scale model of change. In Africa, Asia, and Latin America, this is not new what I'm saying. They have promoted wide changes that are bettering people's life with programs with Albert Bandura, and this is not a talk about Bandura, but with serial drama episodes he made using positive models, negative models, and transitional models. This helped to beneficial styles of behavior. Bandura stated one time that the greater the exposure to the dramatic series, the more as a society we enjoy the benefits left by those before us who collectively worked for social changes that improved our lives. So when, as you know, one of the major, let's say, signs of suicide thoughts is learned helplessness, the inefficacy of not knowing how to act, not knowing how to think. Well, for that, the answer, Bandura says that we can modify the destiny, we can modify the environment, and modify the social system where we live. And this he calls self-determination. So how do serial dramas affect the large population? Well, they could show struggling protagonists who know how to remedy problems when ruminating about suicide. When they say, I'm a burden, I'm stuck and miserable. And even a 10-year-old boy who says, I'm sad, and he's in a panic mode. So these characters can help spectators to slow down despair and succeed in reasons for living. So serial dramas are able to provide social support, are able to care for physical being, calm emotions. They can help show thought skills and advise how to move forward, even with pain. In the essence, the connectedness is what protects and reduces suicide risk, connectedness. Belonging, like Selenia mentioned, all the words come to the same, or the truth touch each other. So when one of the icons that has been, Corey Newman worked with suicide a while ago in his book, and one of his icon books is Choosing to Live. And these are some of the self-beliefs that these adolescents can get into, what we call internal monologues, like dangerous beliefs about self. And then we say, what is the cognitive distortion of this thought? Like, I can't stand the pain. Well, the cognitive distortion would be jumping to conclusions. Or I'm so bad, this is what I deserve. So labeling is the cognitive distortion. I just can't cope like other people. That would be an overgeneralization. I don't know how many of you are acquainted with what cognitive distortion is, but you already heard a bit with Dr. Jesus Salas about this. And this is one of, we work in behavioral and cognitive therapy. The internal monologue is essential to change emotions, change behavior, and it's part of whatever protocol we decide to use. There are many protocols, not just one. So the other self-beliefs are dangerous beliefs about others and the world. Like, hurting myself is the only way we can get the only way I can get what I need from others. That would be like jumping to conclusions. No one will miss me when I'm gone, disqualifying the positive. And they'll be sorry. That's again jumping to conclusions. Again, the word about beliefs about the future, like I'm saying again, because this is just the tip of the iceberg. There's so much information, there's so much you can do, but it's not enough to keep it among us. It needs to be out there. It needs to be in the conversation, in the public conversation, and that's what caught my attention about the work of Bandura. So beliefs about the future: I'll never be loved, jumping to conclusions again. I have no reason to go on. It's like a mental filter. And the next life will be better, jumping to conclusions again. I'm sorry about that. I think it's some interference. Are you there? Hello?
Yes, yes.
That is an
baby.
interference of the computer. Maybe the internet went off. I don't know.
Yeah, well, I think you're back again.
I'm back. I think it was the internet. Sometimes we have with the light or something. Anyway, let's continue. This observational learning is one of the major contributions of Bandura to psychology, social psychology, and it's equal to what it's called vicarious learning. It's observing others perform and be reinforced by a similar task. So observational learning is the capability to learn from others via modeling, via imitation, via the plan of alternative strategies, and with behavioral and emotional regulation. And very clear example of suicide is suicide is a learned behavior. We have the case example of Ernest Hemingway. Like his father, he killed himself while suffering physical illness. Both father and son used guns and both killed themselves when others were around. Ed Hemingway, the father, when his 13-year-old son was at home, and Ernest Hemingway when his wife Mary was at home. In this case, the suicidal ideation was anger towards the family, and it was a learned behavior, as you can see. Another way of learning is by imitation, and we can go, if we go back to the Sorrows of Werther, in a book, a very, very famous book in Germany, the imitation of suicide because of the lack of love it created a mass suicide in Germany. They had to ban the book. Imitation allows us to learn new behaviors quickly and efficiently by watching those around us, by watching reels, as Selena was describing in Instagram, by watching films, by watching serial dramas. So behavior, again, behavior is learned from the environment, how a person observes, imitates, and models behaviors and its outcomes. Again, if we go to the Henry Ford Foundation, they quote that 1.4 million suicide attempts each year. That's what we have. And 12 million people have suicidal thoughts each day. That's really very paralyzing, if you can say so. So powerful storytelling can unlearn hopelessness, shift emotions, and modify behaviors. Powerful storytelling can show struggling protagonists who know how to remedy problems when ruminating about suicide. I'm a burden, I'm stuck, I'm miserable. And it can even modify the thoughts of this 10-year-old son, a boy that we set in a panic mode. So a serial drama plotline includes the positive models exhibiting beneficial lifestyles, negative models exhibiting detrimental ones, and transitional models changing from detrimental to beneficial styles of behavior. So seeing transitional models similar to themselves succeed by perseverance raises the observer's belief in their efficacy to improve their lives by their actions. So you can see how powerful this can be, and it already is. I wonder if we could have some students review what the major films. I saw recently Pussy in the Boots. And if you see, you can count as a behaviorist, you count the number of times that the comic kills the other. That is very surprising. And we need to, if we see the number of, when you scroll down the television at night, I don't think I'm exaggerating if I say that between 80 or 90% of what is available to see contains violence, contains suicidal images. It's really very scary. And how about if we do something about it? I mean, the mental health professionals, media mental health, that's why we're in this organization. Because modeling, we can, via modeling, we can persevere, we can teach values, we can teach competencies and skills, but not enough in a one-to-one basis, not enough in an organization. It needs to go much, much further. It needs to be ubiquitous. If you need, I just came back from Canada. If you listen to the best radio station, classic, good morning, you're in an upside down world. So we are in an upside down world. And how about if we contribute to some changes? And this is not an invention, observational learning. What happened in January 6th, it turned that aggressive behavior is a public health problem, correct? And the Lancet again says that as a real action to prevent suicide, a collaborative care plan should be formulated that offers the young person autonomy in decisions. And this approach can be standardized into domains, the historic, future, modifiable, and protective factors, and a defined care pathway. Anyway, following initial assessment, practical resources and planning must be provided and the care plan revisited regularly. So I invite you to watch this YouTube of Albert Bandura. It's called The Power of Soap Operas. And we can discuss it in the future. So, and Antonio Gutierrez, the Secretary of the UN, he says, the world needs to choose between collective suicide and collective action. That's a very powerful statement, right? Well, thank you very much, New York. And well, we're now for Q&A anytime. Let me stop share.
Yes, thank you.
Okay.